Harris.
And I'm Eliza and we are two brown chicks changing the face of therapy on both
Both sides of the
sides of the
couch.
couch.
Welcome back. Happy New Year. We're back with another episode. And we're hoping this will be helpful. We're going to be talking about finding a therapist. We know that at the beginning of the year, a lot of times we're looking for ways to improve life and ourselves. And, we know that therapy is a really good resource to have. And oftentimes we don't know where to begin when we're looking for someone to talk to.
That's right. And we could have sworn we've done an episode dedicated solely to this, but clearly we have not. And there's so much that we need to process and heal from 2020 and from 2021, right? So we're still in a pandemic. There's still civil unrest. Lots of us feeling ungrounded, and so this is the best time, if ever, to be in therapy. So we're going to focus also specifically on finding a Black Latinx therapist. Why? Because that's what we specialize in.
That is what we do. So oftentimes, one being therapist, I feel like the first go-to people, if you know a therapist, that's the first person you're going to talk to. Like, hey, I need a therapist. I've gotten plenty of those text messages, phone calls, people that I haven't talked to in a while. It's like, hey, I think I need to talk to somebody. Do you know anybody? So, and I don't mind it. Clearly, we have Melanin Mental Health. We have resources. I love the fact that I have a network of therapists that I feel comfortable referring to. But that, I think, is the first place I always say to start is start talking about it with the people that you have in your life. If you have friends or family that are in therapy, ask them how they found that therapist, how do they like their therapist, things like that. So I always say start with family and friends, see if someone has a good recommendation. Because typically when someone that you get along with, someone that you love and care about, have found someone that they click with, you might click with them as well. So that might be a good place to start.
That's right. You can also seek out the referrals from a medical professional if you have a trusted physician that you see regularly. You could also ask your physician if they have any referrals of any therapists that they work closely with. That's always a really good source of referrals, also.
Mm-hmm. If you've never done therapy before and you're just not sure about it, check and see what your medical insurance includes. You may have access to clinicians that are on panels. You may have employee assistance programs, which typically means you don't have to pay for anything for at least like 2 or 3 sessions. And some of them are even better. They give you like 10 or 15 sessions. So start there to see if there are any therapists of color. And you can typically ask. I know we've talked about before that I'm on a couple EAPs. And if you say, I want an African-American therapist, they will do their part to try to find one, so let them know what the issue is. Let them know that you're looking for someone, a clinician of color or a Black Latinx clinician, and they'll be able to kind of give you a list of referrals that will fit your needs.
Right. And you can also do some of that researching. They usually have a website where you
Mm-hmm.
go, you get to look at all your benefits and who's in network with you. What I would add to that also is find out what your out of network benefits are,
Mm-hmm.
because some plans, they cover up to a certain percentage of reimbursing you if you see somebody out of network. So find out what your out of network benefits are, because that's another route that you could also take.
Especially if you have a what's it called, a deductible.
Mhm.
There are times when you have to pay a certain amount out of pocket before your insurance benefits even kick in. So that really means that you could probably just see anyone, and that'll go towards your deductible as well.
Right. One that I would add is if you have a university or a college in your area or nearby, a lot of times the psychology department will have a clinic on hand, will have students that need to get hours. So, and then if you are a student at that university, a lot of times the therapy is available to you for free or at a really low cost. So
Mm-hmm.
I would say check with your local universities, find out if they have a clinic on campus. That's another great way. A lot these therapists, these students, they're therapists in training, And a lot of the times they're being closely monitored by seasoned clinicians who are also supervisors, who are guiding them. So that's another option.
Right. When we were talking about like the insurance and the out of network, I always want to make sure I mention that typically you can pay for therapy with a health savings account or a flexible spending account. So as we talk about trying to find people that are in your like specialize in what you need help with, sometimes those people aren't in network, but you can often pay for those with your medical expense account, and that's a way to use that tax-free money to pay for therapy. But along with that, like obviously Google is a thing, and literally if you search Black therapist, Latin therapist, Latinx therapist, or whatever, you'll be able to find clinicians. And what typically comes up are directories. And there are lots of directories, but you also know that Melanin and Mental Health has a directory.
That's right. I mean, I hope you know that we have melaninmentalhealth.com. It is a national directory. And so we are still adding more clinicians daily, but you can go on there and just type in what city and state you're in, and find out who's in your area. You can also type in the state, right? Like to find out who's in your state, because anybody who is licensed in your state, for example, we're in Texas. So anybody in Texas is licensed to be able to see us, which is great because that gives us more options. It's always been like this. People have always been able to do telehealth, but not as many clinicians were on board prior to the pandemic. So now the good news with that is you have a lot more options. So somebody that, let's say you're in Houston, you always wanted to work with them, but they're in Austin, this is the time that you can have more options to be able to do that.
Right. And I think that's a big thing. Even for me, I've been looking at clinicians all over Texas, because you just have a lot more access. And I know that that's something that we've talked about, where depending on where you live, you may not have as much access to clinicians of color. And so now that most therapists are at least some version of virtual because of the pandemic, you actually can access, if you live in a smaller town, you can access therapists that maybe live in bigger cities. And especially when we're talking about if you're looking for specialties or if you're looking for insurance or whatever the case may be, you have access to more clinicians. So make sure that you're not only looking for in your area. Virtual counseling is very, very, what's the word? Not practical, but convenient, but also it's just as effective. There's been research that shows the effectiveness is the same. So
that's
so
how I've been seeing my clinician during this whole pandemic, my therapist during the whole pandemic. And I'm so thankful for her. I'm so thankful for her. So yes, lots of healing can still be done. And it's the world we live in, right? Like we have to adapt that this is the world that we live in. And that's what I thought was exciting, like I said, is because some therapists weren't down with it. Some clients weren't down with it prior. Right. You know, you and I have both always offered telehealth, but not everybody was with it. And now it's kind of like everybody gets it, everybody understands, you know, so lots of possibilities now.
Yes. So those are lots of ways to start, you know, talk to people that you trust, search online, talk to your insurance company, talk to clinicians, talk to the therapists that you want to work with, and find out what their rate is. Find out if they have any scholarship programs. Find out if they're a good fit for you as well. That's one thing that Elisa and I are really big on, is the consultations that we offer. We encourage other clinicians to offer that as well, just because it gives you an opportunity to actually have a conversation with the therapist and see if that feels like it's a good fit. Like I've had conversations with people and they're like, I just like your energy, you know? And so then you're already starting off on a good foot with that therapist because you already feel like y'all connect some type of way. So try to, you know, if they offer it, try to take advantage of those phone calls so that you can see if this is a good fit, because once you've already kind of started to build that rapport, it makes therapy the process a lot easier.
I also think it's important, you know, as the therapist, it's important for us to also be able to tell you if we feel like we're going to be able to support you. If what you're looking to work on is out of the
Yes.
scope of our expertise, if there's so many reasons, because you will get the most benefits from therapy depending on what your relationship with your therapist is like.
Yeah.
That's why also we are so big. Ebony and I are both huge on our communities, Black Latinx communities, having access to therapy, changing how we talk about mental health, changing how we talk about therapy. And part of what we know and what the research shows is that people have more what's the word more success when they have a really
Yep.
strong connection with their therapist. And when it's important to you to have a therapist who understands the nuances of your culture, of your race, of your gender identity, whatever, right?
Yeah.
Like,
Yeah.
then being able to specialize that and guide people that way. So again, call them, get a feel for them, ask them the issue that you are wanting to work on. What would be their approach to helping resolve that? So
Mhm.
you get to ask questions. You get to ask questions. And I would say, if it's not a good fit from the beginning, don't give up on therapy, right? Like, don't give up on therapy. Just like if you went to a dentist and you didn't like that dentist, you wouldn't let your teeth rot, right? Like, you
Mhm.
will go find another dentist.
Mhm.
So don't give up on therapy. It's very much like dating, in that you're not dating your therapist, but you're kind of getting to know if this is going to work for you. So if it doesn't the first go round, that's okay. It gets something that happens. Make sure you don't give up and try again. And
Yep.
sometimes even that therapist, if you're able to have that conversation,
And give you some
will,
referrals.
yeah, they should give you some referrals.
Yeah.
So
Yeah. So hopefully that was helpful. Let us know if you have any other questions about starting therapy. We're always interested in topics that y'all want to talk about or y'all want to hear about. We have a lot of perspective, obviously, as therapists and as people that have been in therapy. So feel free to let us know if you have any more questions when it comes to starting therapy, finding a therapist, anything like that. Make sure you check out Melanin Mental Health to find a dope therapist if you're looking for one. You can search, like Elisa said, based on location. You can search based on ethnicity and race. You can search based on specialization, insurance, all of those things. So make sure you check that out if you are looking for a therapist. And check out the previous podcast at melaninmentalhealth.com and our dope merchandise. Please subscribe, like, share, all of that with this episode, and we will talk to y'all next week. Bye.
bye.